Hello, everyone. We are group number 2. Our group members include James Lambert, me, myself, Desiree Delora, and Linda No. We are glad to have this opportunity to present the research we have been doing the past few weeks regarding tackling malaria in Nigeria.
According to the CDC 2022, malaria is a disease that can caused by an infective parasite that feeds on humans and is transmitted infectively from female mosquitoes called Anopheles. Once transmitted, the parasite is found in the red blood cells of the infected individual, but can also be transmitted through organ transplant, blood transfusion, congenital transmission, or sharing needles and syringes. They thrive in tropical and subtropical geographic location, which makes Nigeria the perfect place to breed. In 2020, there has been an estimate of 241 million cases worldwide, with an estimate of 627,000 deaths. And in the African region, it accounts for 95% of cases and 96% of deaths. Out of all those cases, Nigeria is top at 27%. The mortality rate is at 62 per 100,000 population, and the burden of malaria in pregnancy is 11.6 million, which is roughly 34% exposed to malaria. Children under 5 with a total malaria-related death is 77%. Risk factors includes the population of pregnant women, infants, children, older adults, and compromised individuals, and those traveling from areas with low rates of malaria. High-risk case in Nigeria includes poor healthcare delivery system, insecticide resistance, and climate change.
Some prevention approaches that we focused on in 3 major programs include the United States President's Malaria Initiative Program, also known as PMI, and the Rollback Malaria Partnership to End Malaria, along with the Nigeria Support at National Malaria Elimination Program. Some of the primary prevention approaches that are focused within these programs are delivering interventions. Examples include insecticide sprays and insecticide-treated nets, along with diagnosis tests and preventative treatment for pregnant women, along with seasonal prevention treatments and investing more in a stronger healthcare system, training and mentoring medical workers, along with improving data collection and strengthening the supply chains for medicine, and reinforcing health policies. Some secondary prevention approaches include research and development for new malaria vaccinations and medication, known as ACT, and innovative solutions for early detection of malaria.
For Section 3, we discussed major challenges and recommendations. Our first challenge was children's health inequity with malaria. Our recommendations align with the goals of Sustainable Development Goals number 3, which is to achieve universal health coverage, the adoption of universal health coverage for all, provide better maternal education, create policies to reduce poverty, access to quality essential healthcare services, and early administration of anti-malarial medicines and vaccines. The second challenge that we identified was treating malaria with less effective medicine as the first line of defense. Our recommendations include the improvement in performance standards of medical staff, more guidance and oversight on safety and efficacy and regulatory standards within their healthcare industry, ongoing enhanced technical training, and reevaluation of continuing medical education. Our third challenge that we identified was the financial barrier for vulnerable population and pregnant women. Some of the recommendations include ensuring research and development efforts are directed towards existing needs, economic stability interventions to help increase the number of health-related jobs in the region, resulting in reduced levels of poverty, providing more malaria awareness and community outreach programs, and to focus on policies to ensure children graduate high school and higher levels of education. Our fourth challenge that we identified was resistance to insecticides. Recommendations that we found include increase in funding for research and development for malaria control tools such as insecticide nets, spraying, resistance monitoring and surveillance, better management of funding, and we end with further studies are needed to determine underlying mechanisms of insecticide resistance for improved malaria control strategies in Nigeria.
Overall, we found that there are countless lessons to be learned from prior malaria eradication programs and very substantial gains that could be made if universal healthcare coverage and corresponding policies could be implemented. Investing in malaria prevention programs also will lead to more resilient health systems, which will overall enhance pandemic preparedness and prevention, and ultimately produce healthier populations. To overcome the challenges discussed in this paper, the international community must come together to address health worker shortages, close knowledge gaps, improve training, and acquire the appropriate equipment and facilities, along with boosting inadequate information sharing systems. This can only be accomplished by strong leadership with intersectoral collaboration to ensure adequate funding and the development of area-specific programs that support and care for the poor and underserved populations.
If you have any questions or need any clarification, please feel free to contact us via the emails provided below. Thank you.
Thank
Thank
you.
you.